of you, and thank you for having us here. It's really very nice to see that the patients have been invited even before the other speakers, because that gives us a chance to make you hear what we would like to say. So thank you very much for that. Now, what are the expectations of a patient? Some of the general expectations include the need to be listened to, which is the most important thing, the need to receive clear explanations and instructions about their condition. The doctors feel that they speak in technical language which is not understood by the patient, and so that is important. It is the patients expect to be treated by staff who show little concern about them, little compassion about them, and they care for them. And they want to be treated by staff and doctors alike who are professionals in their work. And so now it becomes the role of a patient partner. What is a patient partner? Patient partners are equal members of research teams and provide input during various steps of a research study. This could include study design, priority setting, gathering and analyzing data, and helping distribute and implement research results. We've often seen that results and trials are designed without taking the input from patient and the committee. So that is a very important part of it. What is patient engagement and partnering with patients in research is all about? Patient engagement in research is an approach that involves meaningful and active collaboration in governance, priority setting, conducting research and knowledge and translation. The important needs of a patient include water, food, air, activity, sufficient rest, and elimination. There are 5 stages of patient engagement, which means you should have a vision. The organization's vision should be very clear. There should be a goal, that is a stated goal to support the vision, timeline, tactics, and outcomes. Beyond details of air, water, food, and sex, need for safety and security, and the need for love and belonging, and the need for esteem. It is important that the patient is made to feel important, and also self-actualization in that order. And there are 4 pillars of patient engagement, and those are environment, expectations, care, and value. You can create a patient-centric practice that fosters loyalty, referrals, and long-term success. What is the most important patient information? The most important patient information is the patient data. The chart must contain enough information for a physician unfamiliar with the patient to provide appropriate care. This should include psychological information, physiological information, therapeutic information, and any other special patient characteristics such as allergies or handicaps. What is good patient information? Good patient information ensures that patients are prepared and fully aware of the next step in their pathways so that they are able to plan ahead. It helps to involve patients and carers in their care and improve their overall experience, and also the enhanced recovery. The purpose of the patient data is that if there is a small amount of data from many patients which is linked up and pooled, then research and doctors can look in the pattern of the data, helping them develop new ways of predicting or diagnosing illness and identifying ways to improve clinical care. Digital technologies are increasingly empowering individuals to take charge of their health and improve their well-being. However, there are disparities in access related to demographic, economic, and socio-cultural factors that result in exclusion from the use of digital technologies for different groups of the population. The development of digital technology in health is a powerful lever for improving care and services, and it also brings risk for certain users in vulnerable situations. Increased digital health inequalities are associated with limited digital literacy, lack of interest, and low levels of self-efficacy in using technology. To foster responsible and optimum innovation, use of digital health by all, including vulnerable groups, we propose that patient and citizen engagement must be an essential component of the research strategy. Patient partners will define expectations and establish research priorities using their experimental knowledge while benefiting from rich exposure to the rich research process to increase their self-efficacy and digital literacy. Founded on the principle of equity, diversity, and inclusion, this base of citizen expertise will assemble individuals from different backgrounds and literacy levels living in vulnerable situations to acquire knowledge and share their experiences. Digital tools facilitate clinician patient collaboration and encourage patients to interact and participate actively in their care. So what we have to see is that, people are working together, they are getting involved in their treatment, and they are understanding what is being done. We have to understand there are unrepresentative people in that, which are the older people, people with disabilities, and youth in difficulties, people from cultural minorities, and there are, so we have to take care of all those things. I would like to conclude by saying digital health technologies have changed the way healthcare is experienced by patients. Research highlights the disconnect between the development and implementation of digital health tools and the patients they are created for. This review may serve the foundation for future research incorporating patients' perspectives to help increase patients' engagement and emerging technologies. Thank you very much.